and Jen Lunsford, all of whom are co-sponsors on this bill. Joining us today are the all-important advocates, the folks who brought this issue to us, who worked with us as we developed this piece of legislation. Ashley Gant and Stanley Martin from Free the People WROC, mental health advocate Melanie Funches, Lee Rowland from NYCLU, and also Mr. Joe Prude, Daniel's brother. We all know that on March 23rd, 2020, Mr. Daniel Prude, a 41-year-old African-American man, was fatally injured after being physically restrained by police officers here in Rochester. Mr. Prude had been suffering from a mental health episode after ingesting PCP and was walking naked in our city's streets in the cold, frigid winter weather. During this interaction, officers put a spit hood over his head, held him down, and at one point he stopped breathing. A life that was taken far too soon. Mr. Prude's death further shook the trust of our community that was still reeling from the deaths of George Floyd, Breonna Taylor, and countless other Black and brown people across this country at the hands of police. Across our community, people were rising up, their voices crying out, demanding long overdue change. Time and time again, we've seen the police response to mental health emergency escalate the situation, leading to unnecessary violence and even death. The tragic death of Daniel Prude last year and the recent pepper spraying of a 9-year-old child have rightly outraged our communities and shown that real change is needed to prevent more tragedies like these from occurring. This legislation will help ensure our most vulnerable friends and neighbors are directly connected to trained mental health professionals who will treat them with compassion at their time of need. Simply put, New Yorkers that are experiencing mental health and substance abuse crises are best served by the public health response, one that maximizes consent-based care and services and minimizes the role of law enforcement and the use of force. In this past week, we have seen yet another example with the young child who was pepper sprayed. We cannot allow another life to be taken, a family to be left heartbroken, and a community left traumatized. That's why we have introduced this legislation, Daniel Law. Daniel's Law will put New York State on the path to do the right thing in serving our community. It will set up mental health response units that are trained to de-escalate mental health and substance abuse emergency situations, which are typically nonviolent in nature. While police officers are often the ones called to these types of situations, they frequently lack the experience and the training they need to properly help these individuals. This legislation would create a state and regional mental health response councils, as well as what I had said just a moment ago, the mental health response units. They will step in and respond to these emergencies instead of police officers. I look forward to working with my colleagues, in particular my partner, Senator Samra Brouk, and the entire greater Rochester area majority state delegation as we move this legislation forward. I continue to look forward to our work with the advocates to have their input in any changes that might come forward, and all other stakeholders. This is an important piece of legislation. Thank you for being here today. And I'm going to now turn it over to Senator Brouk, and then we're also going to hear from the advocates and Mr. Joe Prude. So, Senator.
Thank you so much, Assemblymember Bronson. And I just want to take a moment to thank you for your leadership on this piece of legislation, and a tremendous amount of gratitude to the organizers and advocates who are here with us today, some of whom who have lived these traumas and tragedies and continue to show up and work with us on how to build a safer and more inclusive community. Our community has seen twice in the past 6 months that police officers are simply not equipped to handle individuals experiencing a mental health crisis. In September, we learned of Daniel Prude's death on a freezing March night. And then just last weekend, we saw another egregious example of police violence when a 9-year-old girl in distress was handcuffed and pepper sprayed. Our current system for supporting community members in crisis is broken. Since last summer, while so many of us had our own struggles going through the pandemic, this community still came together from all over the Rochester region, city, suburban, and rural, time after time, to stand up and speak out about what they needed. This is the community that I know and love. And this is the community that I want the world to know, not the one that has been splashed all over national media this past year. I want the people in our district, our families, our friends and neighbors to live free of the fear that they or their children will be assaulted or killed by police when they're in distress. By this point, we've heard personal stories, we've read the data, and it's crystal clear that the crisis response system that exists today is not effective, and in some cases can even be deadly, especially for many of our Black and Brown neighbors. The hard truth here is that we are not all created equally under the law. And this inequality is compounded when an individual is in a mental health or substance abuse crisis. To do better, we need to provide people with care and treatment, not push more members of our communities into jails and prisons. Our jails were designed to incarcerate. They were never designed to be mental health facilities. And we need to rebuild our community's trust in the institutions that are meant to support and heal them, because that trust has been shattered. And it's not just in the past few months, but over years of violence and brutalization. As the chair of the Mental Health Committee, it's incumbent on me to help to end this cycle. Daniel's Law will provide essential, compassionate mental health services for those in our community who need it most. And I'm here today proposing this legislation alongside my colleagues because I know we can do better. Our community here in Rochester wants us to do better. Residents across the state want us to do better. So now it's time to put in the work to transform our systems and make sure we don't see a tragedy like Daniel Prude's death ever again. Thank you.
Senator, thank you for those comments and really for putting this all in perspective of what needs to happen, the transformative change we have to have in addressing mental health and substance crises. So, thank you for partnering. And now we will turn to Ashley Gant, who is a lead organizer for NYCLU's Genesee Valley chapter. Her leadership has been vital to the Black Lives Matter movement and to Free the People WROC. Ashley's advocacy and pursuit of justice for all people have been critical to moving our community forward to be better. I want to introduce Ashley Gant.
Thank you, Harry, so much. I want to be clear that I'm speaking today on behalf of Free the People WROC, and I do want to thank NYCLU for the role that they've played in helping draft this legislation. So yeah, I'm going to proceed with the statement. So in September, our community was completely shaken by the news of Daniel Prude's murder at the hands of the Rochester Police Department. Joe Brouk called 911 because his brother Daniel Prude was in distress. Joe recognized that his brother was desperately in need of help, so he relied on the only option readily available to him, the Rochester Police Department. Unfortunately, as Joe waited to be updated on the details of his brother's whereabouts and condition, Daniel Prude was laying naked in the middle of the street dying due to excessive force by police officers who were entrusted with his care. This horrific story has brought so many problems to light. We saw firsthand the inefficiency of police response to individuals dealing with mental health crises. Secondly, it was made abundantly clear that the lack of transparency and accountability that permeates the ranks of our elected officials and our police department. It is completely unacceptable that we have a police department that is primarily responding to crisis calls that they are ill-equipped to handle, yet they have the freedom to do so without consequence or accountability when things go wrong. We must be honest and recognize the failures of our police system. For too long, we have simply accepted the police response as the only response. The community has seen, heard, and experienced. This community has seen, heard, and experienced numerous cases of police misconducts, but our critiques and grievances have been downplayed because we are told time and time again that the actions of these officers go by the book. Well, it's time to change the book because we know that there is a better way. We have listened to the voices of the community. We have met and learned from mental health professionals who live and breathe this work. Sorry. We do not want to simply create something based on idealistic fantasies, but we wanted to have a community full of people with real lived experiences whose voices are vital to this progress and change that we know that we are capable of. There are mental health professionals who have been properly educated and trained to handle a variety of crisis situations. Daniel's Law is the first step toward a much needed change in mental health crisis response. It promotes a system that works towards decriminalizing mental health crisis issues. When these calls are made, what is needed first and foremost is care and support. It is absurd that members of the community hesitate to call 911 because they are not confident that the individuals that show up will actually assist in their time of need instead of escalating the problem. The RPD has not given us any reason to trust that they can show us any true level of consistent discretion or tact in any of these calls that they respond to, much less mental health calls. We also recognize that mental health crises fall within a spectrum, and therefore a singular approach is not sufficient. Whether an individual has an ongoing mental health issue or is experiencing a crisis brought on by specific triggering events, they deserve a response. They would deserve a response and care that addresses their specific needs. We have within our power to actually give community members the care they need and deserve. We must no longer put time and resources into efforts that simply attempt to reform a broken system. We must have the courage and audacity to create new models rooted not only in aggression and force, but models rooted in compassion. Having a mental health crisis should not be a death sentence. Right now, all eyes are on Rochester, and we have an obligation to disempower the system that failed Daniel Prude, disempower the system that handcuffed and pepper sprayed a 9-year-old child. Daniel's Law is our chance to respond to the needs of our most vulnerable community members with compassion, care, and expertise. It is our chance to get it right, to act with courage, and to change the outcomes when in the midst of a crisis. Thank you.
Thank you, Ashley, and you couldn't be more right. It's time to change the book. It's time to move us from an approach of control and force to one of compassion, care, and treatment. So thank you, Ashley. Next, we're going to hear from Stanley Martin, who is an advocate, an activist, and an organizer. Stanley's passion for social justice and fairness are unparalleled. Stanley's steadfast commitment to Free the People ROC is going to help our community put an end to the injustices being experienced by our Black and brown brothers and sisters. I'd like to introduce you to Stanley Martin.
Hi, everyone. Thank you all for being on this call. Thank you to all the organizers and advocates and people who have taken to the streets, the people who've occupied City Hall, and the people who've made phone calls to our state and local legislators asking and demanding change. Over the course of the last year, communities across the country took to the streets to demand justice for Black lives and justice for Daniel Prude, a man who was callously murdered by the Rochester Police Department while experiencing a mental health crisis. The Black Lives Matter movement, one of the largest popular uprisings in the history of our nation, was triggered by state-sanctioned police murders of Black people, the kind we have known for far too long, but which the world is finally beginning to understand. The leaders of these protests have often been the family members of those who the police have taken from us. Brothers, mothers, sisters, spouses. Grieving, these brave family members took to the streets in search of community, in search of understanding, and most of all, in search of an immediate end to the system that stole their loved ones and the beginning of something that puts families and communities first. Drafted in close collaboration with my brother, Joe Prude, mental health advocates, activists, and community members, Daniel's Law is a necessary step towards the realization of an alternative future that does not falsely equate policing to public safety. Police do not keep us safe, and the recent brutalization of a 9-year-old child in need of care, love, and mental health support at the hands of RPD demonstrates the urgent need for systemic, bottom-up changes in order to protect the most vulnerable members of our community. The implementation of Daniel's Law constitutes progress towards a meaningful abolitionist vision that allows us to think beyond cages and armed violence workers and instead creates solutions grounded in mutual aid, mental health care, and community support. If we are to honor the efforts of this historic movement, if we are to take seriously the cries of our neighbors whose loved ones were taken from them by this punitive, violent criminal legal system, we must reimagine public safety instantly. And Daniel's Law is the first step in making our wildest dreams a reality. Thank you all for being here. Thank you, Joe Prude. We follow your lead. We thank you for your courage, and we will always be here for you and for Daniel Prude. Thank you.
Thank you, Stanley. And one phrase you said is exactly what this is all about, and that is hearing your voices. And in hearing your voices, this piece of legislation is systemic bottom-up change. It's because of the advocates that have been involved. It's because of Joe Prude, who's been involved, that we've gotten to this point. And I'll share also that our state delegation made a commitment while we were campaigning last year that we would look at public policy through the lens of racial justice. And this bill does exactly that. So thank you, Stanley. Next, we're going to hear from a mental health advocate, Melanie Funchess. Melanie's experience and expertise have been invaluable to the development of Daniel's Law. Her work in community engagement for the Mental Health Association of Rochester and her lifelong commitment to advocacy for those in crisis and in need of help brought an understanding that was essential in the crafting of this legislation. Melanie?
Thank you. I first would like to thank you, Assemblyman Bronson and Senator Brouk, for your commitment to this new day. What we are standing for today is a watershed moment. It's a moment for us to reimagine and put the work in to creating a new way for supporting people living with mental health challenges every day. We can go from criminalizing and equating mental health challenges with violence to a truly supportive and loving, caring approach to the care of those who most need it and the time when they most need it. Daniel's Law represents the beginning of a new era, and I am so proud to be part of this new change. At this time, I also want to say thank you to Joe Prude. In the face of what would seem like an insurmountable amount of grief, he stood up and said no more. And I just want to say thank you to you for your courage and standing strong. I want to say thank you to the Black Healers Network of Greater Rochester, a group of Black mental health professionals who understand that not only is mental health related to medical, but it's also related to race and culture, and that we need culturally responsive approaches to help people get the help that they need. And I just want to say thank you again to our Rochester delegation. Your Rochester delegation is dope. And I just want to say that, and I want to say thank you.
Thank you, Melanie. And your point about making sure we have culturally competent people who are responding, making sure they understand the issues of our Black and Brown communities is vitally important. That's built into this bill, and it's there in large part because of your advocacy. So thank you, Melanie. This goes unspoken, but no one has been impacted more deeply by the death of Daniel Prude than his brother, Joe. Joe has been a voice for truth, a voice for justice, and most importantly, a voice for his brother. I'd like to invite Joe Prude to share with us a few of his words.
Hey, how everybody doing?
Hey,
Well, I
Joe.
want to take. How you doing, Harry? Senator Bronson, Assemblyman Bronson, rather. I want to take this time out to thank Assemblyman Bronson, Senator Brouk, and the entire Rochester area statewide delegation for introducing this important piece of mental health care legislation. What happened to my family was a tragedy, and I pray that it doesn't happen to anyone else. Mental illness is not a crime. Excuse me. Like I said, mental illness is not a crime, and it shouldn't be treated that way. With the passage of this legislation, I know that people will now get proper and appropriate treatment to help them get their lives back on track. You know, I really want to take this time out to thank Ashley, Stanley, Melanie, you as well, Assembly Bronson, Senator Burke. You know, this is something that I don't think anyone can properly understand how much pain I really am in. You know what I mean? I'm shadowing it. You know, it's hidden, but I don't know how much more longer I can hide this. You know, and it's like it's tearing me down every day. You know, not knowing if the people who is still on work, they still on paid leave. Then the situation with the 9-year-old girl, come on. How much more that the government got to see that this is not to be tolerated. This is an abuse of power, more let alone that, you know, the systematic racism is still going. It's not it's not going to stop. You know, it's like if we meet force with force, there's no outcome to that. That's a ticking time bomb. But we trying to do this the proper way, and you know, I hope, you know what I mean, by this going into legislation, you know what I mean, they get passed and everything come back to the light, man, where everybody start being treated as equal. You know, I don't understand too much of I'm layman to the law, but I do know some of it. But I just want to see people get the same proper treatment that everybody else is supposed to get. Not just because of the color of their skin and you being treated this way, that way. You know, I just thank all y'all for this, man. I really do, from the bottom of my heart.
Thank you, Joe. Please know we're with you. We're with your family. We will continue to walk with you. We will continue to share the pain with you. And this piece of legislation is a step to help in that regard. It won't change what happened.
No, I know it won't.
But like
I'm sorry about cutting you off.
That's okay. But like you just said, this will hopefully prevent it from happening again and hopefully get us closer to our ideal of equity and justice for everybody. So thank you, Joe. We're going to now, okay. We're going to now go to question and answer. I want to thank all of the folks who spoke today. We'll try to direct questions to the appropriate person, but do we have any questions from the media?
Yes, at this time we have a hand raised from WHEC News. WHEC.
Yeah, hi, Harry. I guess, Harry, you can direct this question to whoever you think is appropriate, or Ashley or Stanley, if you'd like to answer this. I'm wondering if you think if Daniel's Law had been in place back in March or Friday in the city, how do you think things would have worked differently?
Yeah, I will take that first, but then I'll ask Ashley or Stanley if they want to chime in from an advocate's perspective. But this law would have a good chance of preventing what happened to Daniel Prude. This law sets up a statewide council on mental health intervention. It sets up a regional council, so there's local control. It emphasizes that in most instances, the first responding folks should be a mental health response unit. Those would be certified by the state. They would ensure cultural competence. They would ensure mental health professional competence. And they would emphasize the need to try to de-escalate situations. And how do you do that? So I'm very confident that this law would have, in all likelihood, a different result. Ashley or Stanley, do you want to take a stab at that as well?
So I do think that if Daniel's law would be in place, we would have a different result than we see with Daniel Prude and we see with the 9-year-old girl. But I also want to add that Daniel's law is not the end all be all. This is just the beginning. And along with Daniel's law, we need police accountability. We need police officers to be held accountable when they violate people. And Daniel's law alone is not gonna bring about change. We need Daniel's law coupled with police accountability as well.
Thanks, Ashley. Stanley?
Just echoing what Ashley said, I think it's really important to reallocate funding from police to mental health crisis response units. We know because of COVID-19, there is going to be a funding issue, but we see the police budgets being bloated over the years, and we know that they're ill-equipped to respond to mental health and substance use crisis. But in our community, we have mental health advocates like Melanie, like Shaku, who are trained to de-escalate and show people love and compassion. So we want to ensure that we are fully putting mental health workers in place by defunding the police in addition to implementing Daniel's law.
Okay, next question.
Harry, we now have a question from Tanner with 13 WHAM News. Tanner?
Hi, good morning, everyone. Harry, or if anybody else wants to weigh in also, can you just talk about, I guess, a little bit more about the logistics of how you're envisioning all this will work from when a call comes in to when a team responds? And then we've heard a lot about the new PIC team in the city. We've heard a lot about the FIT team, a lot of local law enforcement leaders just saying there's not enough resources there. I guess what will be done to ensure that when somebody calls this team for help, they will respond?
Well, when we talk about the mental health response units, this envisions that the teams like what the city has put together and what the county has put together, that they could actually be the certified mental health response unit. So, you know, this is really balancing state and local. It also has some mechanisms with 911, and there's also a training component that we would help people understand when it should be a mental health response versus a law enforcement response. Senator, do you want to try to take a stab at that question as well?
Sure, thank you. I don't know if you all can hear me, but no, I think the Assembly member made a really good point. I just want to maybe amplify one piece that I think was really important to getting to this point of it, which was a consideration of our localities, a consideration of the municipalities in the county, and how this would fit into work that is being done. And I think that whether it's here in our area or thinking about statewide as well, we spend a lot of time thinking about that. And I know that the Assembly member has also done certain outreach to folks that, you know, from this point forward, this should be the conversation of how we put pieces of this puzzle together to create more comprehensive coverage to make sure that folks are getting the care and the response that they need.
Okay, thanks, Senator. Another question?
Assembly member, we now have a question from Noelle Evans.
Hiya, thanks so much. My first question is, my understanding in speaking with Black therapists and speaking with folks from their own personal experience, that getting access to not just adequate, but quality mental health care for people of color is not easy, even when seeking it out. And so I'm wondering, could Daniel's law help to change that if either it's someone's first mental health crisis call or if they end up being a repeat field patient, if this could lead to longer term care, follow-up care, or building relationships in that way?
I'll answer it from a technical standpoint in the legislation, but then I think Melanie ought to answer, given her experience in this area. So put in both the state council and the regional council is a development of requiring a response to mental health crisis and substance use with cultural competent care and training. So that's one piece of this. And then the state council has to interface with the SUNY system to develop curriculum that will include those kind of issues, so that we're training folks in the mental health field to understand how to work with and serve communities of color. And so that's contemplated in the legislation. But Melanie, can you share a little bit more about what's actually happening out there and what we're hoping to see out of this legislation of changing it?
Absolutely. Thank you, Harry. What we want to, what will be happening, and I want to echo something that Ashley said. Daniel's Law is the beginning. It is not the end all be all. We are looking to have culturally competent, culturally responsive intervention on the practice level. We are looking at the education level to modify and change the way we train clinicians. So when people are coming out of training, they're coming out with a better toolkit in how to deal with Black and Brown families. We are also working now on the ground to train clinicians in culturally competent anti-racist treatment for Black families, and to also bring some culturally responsive and culturally specific psychotherapy models to our community. That is something that's currently working to happen. And I also want to bring in the thought of peers. Culturally responsive peers can also play a role in this and helping, because they're not only people who have the cultural understanding, but they also have the lived experience of living with mental health challenges. And they will be a critical partner in this work moving forward.
Thanks, Melanie. Next question.
Now we have a question from Gino, an Assemblymember.
Thank you. I have two questions. One, is there an Assembly or Senate bill to look this up on?
Yeah, we're going to provide to you what's called the LBD, which is the document you submit to get a bill number. We do not have bill numbers in either house at this point, but if you haven't already received it with the press release, which I thought you were supposed to, that's exactly what you will see, except for it will have a bill number on the front.
Gotcha. And the second question is, there are about 700 plus RPD officers, and comparatively FIT and FACET and these crisis response teams are relatively small. There's about a handful of workers, about 14 in FIT, 10 in FACET the last time I checked. Is there a sense of how many more people we need actually doing this direct kind of work? And I don't need like an exact number, but how much we would like to see that growth? How many people you think is necessary to actually meet the demand that Rochester has?
Yeah, I'm not prepared to give a number at this point. We know we need a hell of a lot more. But that's why part of this is setting up the state council and the regional councils, because they are supposed to be people who understand this area, understand what's happening now. And so for them, that's part of the equation that they'll put together, similar to what the county and the city is starting to do locally. But this would give it more structure and would actually require them to develop a plan. The plan would have to be certified by the state, and they would have to submit annual reports to the state so that we have transparency and oversight of what's happening. Thank you.
Thank you.
Next question.
Our next question is from Morgan McKay with Spectrum News. Morgan.
Hello, thank you so much, guys. Quick question for you. So speaking to certain law enforcement officers, they have said that, some of these calls can get violent at times, depending on the situation. Is there a plan to maybe have police officers go with these mental health counselors to some of these calls, or would this be only mental health counselors responding?
It would be mental health counselors responding initially. And if a situation merits it, based on the mental health professionals' analysis and their expertise, there's obviously an ability to call in law enforcement. But the presumption is if it's a mental health crisis, then it is the mental health response units that respond.
And just to follow up here, how would you guys necessarily determine these mental health calls? Would they, how would that get directed?
Very good question. That is not something we can statutorily set forth, right? But that's why the councils are set up. So the members of those councils are experts in this area, so that they can develop and determine if there's additional training. We recognize that our dispatching is a problem and a concern, and it needs to be addressed. It is addressed through setting up a mechanism for experts to get that through. We also required dispatch to develop protocols and anticipate the possibility of the future mental health specific 611 number, which hasn't been launched at this time.
And Assemblymember Melanie has her hand raised at this point. I just want to make sure we see that.
Okay, Melanie, why don't you, if you want to add in.
Yes, please. And I'm not an Assembly member. Thank you. But thank you, though. What I wanted to say is that with the mental health professionals responding, what I want people to remember is many times the presence of police exacerbates a situation because of past traumas. And so it's people showing up in the uniform with the whole vest, and it brings out trauma, past trauma for many people, and it escalates a situation. When you're bringing in trained people who are trained to walk into a situation with the skills to de-escalate, we will see, because what's happened is we have conflated mental health with violence. And we know that 96% of all violent crimes are committed by people without any previous mental health.
Thanks, Melanie. Another question?
Our next question is from Patty Singer.
Hi, thank you. This is a sort of a two-parter. Curious about how the funding, will the funding come from the state for the state and regional councils? And how is this going to be prevented from becoming another New York State bureaucracy?
Yeah, really good question about the bureaucracy piece. We know we need transformative change in this area. And we know that in order to get that transformative change, we need a structure. This bill puts forth that structure. It relies on the expertise of individuals who know the mental health area, know other aspects of responding to mental health crises. And so it's our hope that this isn't a bureaucracy, that this is an ability to have a framework on which the decisions can be made and then implemented. As to funding, the funding it's anticipated the funding would go at the state level through the Office of Mental Health, and at the local level, the funding through the services that they're already providing, how they fund their services currently. So we're looking for this law creating a shift to the approach, but utilizing assets that we have at the state and the federal, or at the state and the local level.
So they're going to be budget neutral in a sense, just moving money around?
Yeah, we may have to look at that more, but that's the intent. Yes.
Okay, thank you.
Any other questions?
Our next question is going to be coming from Jim Aroney with Spectrum News.
Okay.
Good morning.
Morning.
Assemblyman Bronson, what is the single hardest sell legislatively for this proposal as compared to any other that has attempted to infuse mental health response to mental health crises?
Yeah, I think, I suspect we're going to get a lot of comments from a lot of people. And we welcome those. We welcome those. We want to get this right. So if there's a valid concern, if there is a suggested tweak, we're going to do our best to listen to all of that and come up with a product in the final passage of the legislation that is going to work and be effective. That being said, there's certain principles that this legislation is based upon, and we're not going to negotiate. And that is that it needs to be a mental health response. And we need that. It needs to be a shift from control and force to compassion, care, de-escalation, and treatment. It has to be a shift toward moving to volunteer custody and treatment as much as possible. So, those are the general, and it has to be, there has to be equity, and we have to look at this through a racial lens and make sure that the policy set forth in the legislation acknowledges that Black and brown people have been treated differently by law enforcement. And in this arena, when we shift to mental health response units, we want them to treat people with equity and respect, no matter who they are.
I'm going to jump in here quickly to amplify some of what Assemblymember Bronson said, and then I do apologize, but I'll need to hop off, but I'll have my staff here if there are questions you have specifically for me. But one thing I just want to make sure we're super clear on, and I think the Assemblymember has done a great job, as have the advocates, of really honing in on the fact that this is a transformation, right? So when we really think about if we are all tired of hearing stories of injustice and death and violence, story after story, I'm talking to a bunch of journalists, you report on these stories after, you only stop that cycle by changing frameworks and structures and making sure that we set individual players up for success. And so I think that, that is the only way we move forward on some of these things, is this kind of transformative change. Whether we're talking existential threats like climate change, you have to be transformative. We're talking about our carceral system and our justice system, we have to be able to move forward with these major transformations to right a lot of wrongs. And I think that both of us are also very, very encouraged and ready to collaborate with all of the stakeholders to make sure that we do this right, but that there are also these principles that I think a majority of people do come together on, in terms of treating people with this respect and care, and getting them, at the end of the day, getting them the help that they need. So I just want to say thank you. I do have to hop, but I'll drop my information to be in touch. Thanks.
Thanks, Senator. So I'm told we have a few more questions. Why don't we take those and we'll cut off the questioning after that. So who's next?
Our next question is from WHEC News.
Okay.
WHEC?
Yeah, thanks again. Appreciate it. I think people can fall into the trap of getting into too much nuance and down into the weeds. But I'm wondering if, Harry, this bill will address, or the transformation of the system will address the fact that, like on Friday, the call came in as a stolen car, which is a potential crime. And then when the police arrived, then it turned into a mental health situation. Is the law going to address that kind of situation?
When I saw what had happened, I saw the reporting about it being an auto theft call. I started thinking about, would this help or not? And I think it may not have helped in that particular call, simply because the call was, it was auto theft. But what should have happened, when the law enforcement were there, they should have then called the mental health team that we have locally. And after this bill's passed, the one that would be certified. But I've got to think a little bit more about that particular situation as we move forward. But Ashley has some thoughts.
Stanley
So-
Martin also
Sorry,
would
Steve.
like to speak.
And then Lee Rowland also
Go ahead.
posted that she wants to comment on that.
Okay, Lee, could you comment about this? Thank you.
I'm happy to. Just really briefly, in the text, the bill draft contemplates a situation where police get to a scene either organically or because they're called, and they wouldn't have authority actually to take control of someone if that person wasn't creating a public safety risk to another person under this bill. And the bill specifically contemplates having the police then call in the mental health response unit if indeed a situation were to pivot like that. Thanks.
Thanks, Lee. And so I'm not sure. Stanley, did you want to say something too, or were you just letting us know about Lee?
Yes, I'd like to add. So in that specific situation, it was specific to the person in crisis team where the system for the police to call the mental health team for help was not implemented. And once again, that has to do with funding and the PIC not having adequate resources to be able to implement things as simple as the police team calling someone from the crisis response to be present. So as we think about this and the barriers to implementation, we have to ensure that it's successful by allocating adequate resources and funding so the situation we saw with a 9-year-old child doesn't happen again.
Okay, thanks. And Lee, thanks for the clarification on the legislative language. Next question.
Assemblymember Bronson, we do have one more question and then we're going to wrap things up. It's from Tanner with 13 Wham News.
Hi, thank you. Just wanted to ask this. I mean, we've heard a lot about FACET over months and years. We've heard a lot about the FIT team and now the new PIC team. I guess, what would you say to people out there who might be questioning the long-term effectiveness of this? I mean, we always hear there's not enough resources, not enough people, not enough money. What do you think this will have long-term effectiveness?
Well, I think it's going to have long-term effectiveness because, again, it creates the structure and the framework for the development of policy, the development of procedures, the development of protocols on mental health crisis calls. It allows for flexibility from one region to the next. You know, what they do on Long Island might be different as long as it meets the objectives, and that is that truly mental health response. And so the long-term effectiveness of this is going to be through assuring that these things are developed, and also you know, that they are required to report back to the legislature on an annual basis, so we can check to make sure that we're meeting our goals and objectives.
Assemblymember Melanie does have her hand raised. She would like to make a comment on this.
Okay, go ahead, Melanie.
Yes, very quickly. Something else I'd like to highlight about this in the structure, it allowing for mandating for culturally responsive, culturally competent care. Right now in our teams, as they stand, there is a lack of culturally responsive, culturally competent care. And so this will add to what already exists, and it'll make sure as you report back that we are able to look at the data and be able to know, are we doing what we said we're going to do? So I just wanted to make sure that is one of the enduring things, this is one of the things that I'm excited about, because it allows us to have the structure to be able to make sure that all the things are doing what they need to do with a precision of fit between the person needing the help and the help that they are getting.
Thank you.
Thanks, Melanie. And thanks everybody for being here. I want to especially thank Senator Brouk and my colleagues that are co-sponsors. You know, this is a Rochester delegation thing, and we are going to push hard for it. And then I want to also thank Ashley and Stanley and Melanie, advocates who we couldn't have gotten here without them. And lastly, I want to thank Joe Prude for you know, being part of this journey We're only in the beginning. We have a long ways to go. We're going to be with you, Joe, and we're going to make sure that we have transformative, systemic, bottom-up change that is going to be effective with this legislation. So thank you all. Greatly appreciate it.